Hello and welcome to the Odd Couple podcast. This is Siddhartha here.
I'm Dr. Ashish.
So today with us we have Dr. Vinayak Vijayakumar, who has completed his MBBS and DPM from Kasturba Medical College, Manipal, and who went on to specialize in addiction from King's College, London. He's a highly respected and widely published psychiatrist who was the recipient of the International Scholars in Addiction Studies Award in 2016. So happy to have you on this podcast. Vinay, if I may call you that.
Thank you, guys. Really happy to be here.
Vinay, my man, am I so glad to bring the doctor on board this conversation, which we've been having for the past 1 year. I mean, this podcast really needed some mental health. We've been having mental health issues, and we really needed someone to come and sort all that up. Right, Sid?
Absolutely, absolutely.
Yeah, happy to come and chat with you guys about this. This is kind of the hot topic these days, especially considering the pandemic and the kind of things people are going through. So, yeah, let's get started.
So, Vinay, you'd be the best person to tell us because all of us have been stuck between four walls, working from home, with this pandemic hitting us last year and still continuing to do so. And there's a lot of uncertainty. I know personally, I had pay cuts. I know a lot of colleagues who lost their jobs. There's a lot of depression going around, and people probably don't identify it as depression or as a mental health issue. So, to start off from a general perspective, what is this mental health all about? And if you can give us like an umbrella overview of it, and then we can try and get into the specifics of mental health and take it forth from there and get some kind of clarity.
Yeah, so like you said, this pandemic has brought in a lot of attention towards mental health. And to be honest, the statistics related to depression and anxiety was really high and it's very predominant even before the pandemic. But it obviously just shot up after this, and a lot of people are talking about it because reasons why people get depressed and anxious, especially when you talk about the pandemic, it's quite obvious. They can have health anxiety, they can have issues related to loss of job, financial stress, all this causing a cluster of depressive and anxiety symptoms. But talking about mental health, the saying, there's no health without mental health. So you just can't ignore that part. You can't say physical health is separate and mental health is separate, because we are one, and we can't really disconnect our mind and body and say, this part is important, this part is not important. I can go on about how mental health problems can cause diabetes and depression and all kinds of medical problems. Yes, the importance of mental health is obviously come to the forefront now, and it's good because I think people are reacting to it and learning to live in ways that reduce stress, improve coping mechanism, basically in ways where they can promote positive mental health.
You made a great point because I think during this pandemic, there have been far more recognizable triggers, as you mentioned, right? Which is triggering of depression, which is triggering anxiety and other related mental health issues. But I remember about nearly a decade back, I had serious anxiety, and I'm not sure it is depression or diagnosed as depression, but definitely extreme anxiety. But I had a great doctor, Dr. Amar of Axon. Hats off to him. He said, Sid, there's nothing wrong with you. I think you need to meet a psychiatrist and take a look at it because I think you need psychiatric help. But the first thing that went through my mind was that, oh my God, what will all my friends think? What will that I'm going to meet a psychiatrist? Like, have I gone cuckoo, right? So there is a certain amount of taboo. But I said, you know what? I don't care. And I just went for it. And it was the best thing I ever did. Seeking professional help to sort it out. And as you said, no, how to cope with it and how do you come out? And I'm happy to say, like, thanks to those coping mechanisms or coping strategies that the doctor mentioned to me, I've been anxiety free for what, 5 years now? But I'm saying, why is there so much of a taboo to go see a psychiatrist or to come and take an appointment with you? Why is that taboo there?
Why is a very hard question to answer, but the fact that it exists is so obvious, even in all classes and all categories of people. My own friends, they have clear cut anxiety symptoms. They come talk to me about it. And when I suggest medications, there's immediately a kind of, they take a step back, they withdraw, and they're like, no, 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 we know about psychiatry medicines and we don't want to go down that path. And 2 weeks down the line, they will have chest pain and ECG would be normal, and the cardiologist would prescribe them the same medicine, and they're happy to take it. So there is this apprehension and fear of going to see a psychiatrist and taking the treatment because of maybe generations of people equating mental illness to being mad, because of generations of doctors, just general doctors, telling patients that no, don't go to psychiatrist. You'll end up taking medicines lifelong. Stay away from them. I mean, I'm talking about doctors. So even when people with this level of education, kind of promote and convey these kind of messages, it's very tough for the lay person to look beyond all this and break these barriers and come forward.
And I think it's made worse by mainstream media also, like movies and everything, portraying it in a negative light.
Absolutely.
No, but Sid, if for me, like what Vinay had said earlier on, which is the fact that we have a lot of people who deal with a lot of stress issues, right? And the issues might be mental, but they never look at it that there's a problem mentally until and unless the physical manifestations happen, like heart attack, chest pain, hypertension, diabetes. And once all of these start happening, they still start looking for treatment for that, and probably not realizing that there are other stress factors which are there. So there's a lack of education, like what Vinay had mentioned, which is people are starting to understand that your stress starts leading to of or mental pressures start leading to other problems.
No, no, I agree with you, Ashish, but at the same time, I disagree with you because, I mean, you're a doctor, so is he, right? But I went to a psychiatrist purely because my GP, my doctor who I went and met for all those physical manifestations of what is happening in my head, right? I was obviously all of us will think it's only a physical problem. Now that person said, you know what, your ECG is normal, everything is fine. It is all just a manifestation, and hence you need to meet a psychiatrist. You need a medical professional to direct you towards the right thing, and I think that is important.
And that's where I disagree with you, because it's not your GP that is the one that's catching it for you. It's you who accepted it and took it. Because I'll tell you, I have a lot of patients who come with a lot of pain issues or whatever they come with. And there are certain types of pain which are psychological. And if I say now, listen, what you're feeling, which you think is physical, is not really physical, but a mental issue. And you need to see a psychiatrist now, because pain also is treated by the psychiatrist sometimes. But they don't accept that. They don't accept that diagnosis. They say, what, you don't know what is really wrong with me. And that's why you're not telling me what it is. You're telling me to go and meet. They don't want to believe that statement. Sid. So you're an anomaly according to me.
I want to say that both of you are absolutely right, and you're highlighting exactly what the problem is. This happens at two levels. The first level, many GPs don't do what Sid's GP did. They don't refer to psychiatrists. Because one, they feel like they might lose the patient. They feel like this is not something. They have this stigma in their mind that psychiatrist means lifelong medicines and all kinds of things. So at that level, Sid was lucky. And the second level of acceptance, he was able to accept that advice and go. So a lot of people don't. Like you said, they stop there and say, no, thank you, but no, I'm going. I don't mind seeing three cardiologists, but I'm not seeing a psychiatrist. And this is how it takes me at least 15-20 minutes to win over the trust of a patient when he comes. I'll tell him this. I'll be like, okay, so I can prescribe you a medicine for your chest pain. I can prescribe you a medicine for your palpitations. I can prescribe you medicines for your sweating. I can prescribe you medicines for your dizziness. I can prescribe you medicines for your lack of sleep. Would you like seven different types of medicine? Or if I told you there's just one kind of counseling and one medicine that can cure all this? And I have to kind of, make him understand that we have to deal with the cause and not just what you see on top of the iceberg, because there's more to it than just the physical manifestations of what they're going
Correct, but you just started sounding like Sadhguru right now to me.
through. But it is all related, that. I mean, if you deal with certain problems at the mind level, you don't really have to worry too much about the physical manifestations. And I said this at the beginning. I was talking about, diabetes and hypertension and lifestyle diseases. Depression is the most disabling disorder in the world. It causes the highest disability. So, you have to realize that it's all connected. If you're depressed, and there's a study, and I'll tell you, this is quite fascinating. They took a bunch of people, they injected them with the common cold virus, the rhinovirus, not the coronavirus, the normal common cold rhinovirus. They took a bunch of people who were depressed and injected them with the same virus. The people who were depressed, the majority of them recovered much later than the people who were not depressed. And this is physical recovery of fever, of the cold, of all this, not the feelings of tiredness. This is physically monitored symptoms. So it shows that the mental aspects affects your immune response. It affects your health in all kinds of ways. I mean, just to highlight that point.
I completely agree with Vinay because a lot of people are hesitant to go to a psychiatrist. Yes, we mentioned a lot of thing, but also in mainstream media, what happens is that, and that's something which went through my head. One is the taboo side. What will my family think? What will my friends think? That's one side of it. The other side of it is, oh my God, am I going to get addicted to medication? Point number one. Or worse, like what I used to see in movies where Mohanlal gets electrocuted and is going on a stretcher after those, what is it called, electro consult, what?
Convulsive therapy.
Yeah, that's what I thought is going to happen to me. But then I realized, going through the process, that usually all these things are far more scarier than what it really is.
So let me tell you this: the lay person or the general population's apprehension is not completely unfounded, because they do have some right to be skeptical when talking about psychiatry or meeting a psychiatrist, because sadly ours is not a foolproof science. I cannot do a chest x-ray or a blood test and say, okay, this person, like how a person can be diagnosed with TB, I can't diagnose him with tests and MRI scans. Sadly, I'm still depending on history taking and eliciting symptoms. So because we're still at that stage, there's a lot of skepticism, and that's why there is a lot of neglect that's happening towards the area of mental health. People with mental health problems, their insurance doesn't cover them, only because there's no evidence. Like they will say, what is the evidence that you're schizophrenic? What is the evidence that you're depressed? I can't do a blood test. It's based on symptoms. So that's why the insurance companies are hesitant. I mean, obviously, America is way ahead, and they have understood that we can't wait till the stage where we get those kind of evidence, and people are suffering and they need it, and they've included a lot of mental health problems in their insurance systems. But sadly, we're still not a foolproof science. We don't have much evidence, and because of that, there's a lot of skepticism in different fields, not only with patients but with the insurance companies, with the law, with every aspect.
Excellent point.
No, correct. But another thing which I wanted to talk about, Vinay, was we talked about it from a perspective of, okay, a lack of knowledge, etc., from a patient perspective, and sometimes from even a medical perspective, there is a lack of understanding within our community. Maybe it's a social problem, a bigger social problem like India itself. But as a friend who has lost a couple of friends to depression also, the one thing that always strikes me at the end of the day is they were always happy. I never saw them sad. Do they generally keep all of this well within themselves and it doesn't come out? Or is it just a lack of my attention to pick up this kind of stuff?
You're going into a point which I'll have to discuss about the kind of problems where a person can think about
No, I
harming
think for
themselves.
most of our listeners, we really love to know, because these are circumstances which we deal with after we have lost somebody. Like I remember the incident last year with the Sushant, the actor, where we had the whole of India rallying up, and here on screen you see this really happy guy, etc. And then later on we find out that he's really depressed, and the people who are surrounded by him are usually caught off guard. I'd like to know and understand, why is it that we all miss this, and we only find out later on.
No, so I'll put it this way. If a person is severely depressed to the point where they're suicidal, they're not eating, they're not sleeping, they're dysfunctional, and I think that's what I read about Sushant. He had this problem for months and he was on treatment for it for months. So it wasn't like it came out of the blue because he was clinically, I think, diagnosed. So if a person is severely depressed like that, it's very hard for the people who are close to them to miss it. It's very hard. But self-harm behavior and suicidal behavior is not limited to depression. There are a lot of personality disorders like borderline personality disorder, the emotionally unstable personality disorders, where they are happy, they are fine. A small thing can immediately trigger them to spiral into a really depressed mood, which goes into a suicidal thought. It could happen in a matter of few minutes. So people with these personalities are very impulsive. They don't really think about things, and they might have had a past history of self-harm behaviors. Could be risk cutting, could be threatening to do something, could be threatening to jump out, or they would have given some kind of hints. So suicidal behavior can happen even outside the context of depression, but when a person is severely depressed, it's very tough for the people who are close to him to miss it, because it really affects all aspects of their life.
And also to expand on that is that I think having a support system is very important. Having friends to help you out and tell them, listen, it's okay, go meet a psychiatrist. Or I've met a lot of my friends who exhibited certain behavior, but since I went through the process, they were just so happy. Oh my God, Sid, did you really go through that? Okay, who did you meet? What it is? And they feel far more at ease to go meet a psychiatrist because one of our close friends or family has actually had a positive experience about it. And that's where it comes to my next question, because a lot of people do the other way around. They don't meet a psychiatrist, but they depend on the friends and family and their support system to get them through it and not go meet a professional like how you normally do for any kind of physical aid.
Yeah, so that's a valid point. And to be honest, there's nothing wrong with depending on your friends for advice. I would say if your friends give sound advice and that advice helps you cope, you don't need a psychiatrist, because then your problem isn't that severe. And this is how we differentiate depression from sadness. This is how we differentiate feeling tense from anxiety, because people can feel tense, people can feel sad, people can feel upset, but they have their support systems. It could be an internal coping mechanism, it could be friends, it could be family to guide them through it, and they get out of it. So they are not clinically depressed or anxious. But if it's getting to a point where it's causing dysfunction, like you're not able to do the things that you normally do, what gave you pleasure is not giving you that pleasure anymore, you don't have the energy levels anymore, you're not able to work anymore, it's affecting your sleep. If it starts kind of permeating through all the aspects of your life and starts to kind of bother you, and obviously at that point I don't think advice from friends would be enough. And that's when I think the friends should probably say, hey, you know this is beyond what I can do. You should probably go talk to a psychiatrist or even a psychologist. And this is very, and I'm getting to this psychologist and psychiatrist because a lot of people still are confused about this.
Oh, Vinay, you know what? That was exactly the next question which I had. Guys, stay tuned on the Odd Couple podcast. We'll just take a quick break and we'll be right back.
You're listening to the Odd Couple Podcast. A Pandemia Inc. production. A friendly fireside chat with friends where no topic is beyond a healthy discussion, punctuated with a laugh or two. Check it out! Tune in every fortnight on your favorite podcast network.
Hey guys, welcome back. You're listening to the Odd Couple podcast. So today with us we have Dr. Vinayak Vijayakumar, a psychiatrist who's been guiding us through the whole maze that is the mental health. And Vinay just made a perfect point. Actually, that was my exact question next, because when I had the problem, which I did, I didn't know who should I go see, a psychiatrist, a psychotherapist, a psychologist, a counselor. I was totally confused. Can you just help me decipher what these?
Or your friendly neighborhood orthopedician.
No, definitely not Dr. Ashish for these issues.
So I mean, Yeah, there's a lot of confusion about this, but I don't, this is a answer even Google can solve, but I'll tell you guys because, I know you might know this, but a lot of people in India still don't. Psychiatrists are doctors, so we go through the normal MBBS routine before we specialize in psychiatry. So we are doctors primarily, and we are the only ones who can prescribe medications for any kind of mental health issues. Psychologists can do a lot of counseling, can do psychotherapy, can do a lot of assessments, psychometric assessments. They can assess your intelligence, your personality, they can rate your depression, rate your anxiety. So they are well versed with both assessment and non medical treatments for any kind of mental health issues. Psychotherapists are basically people who are only specialized in therapy. So they can guide you through cognitive behavioral therapy, interpersonal therapy, mindfulness based therapy, group therapy. So there are lots of therapies. I mean, there's therapies that involve communities, there's therapies that involves family. So they are specialized in therapies, and in that there are people who are specialized in addiction, there are people who are specialized in depressions, people who are specialized in anxiety, there are marital therapists, there are sex therapists. There are a lot of specializations there. Counselors, honestly, it's kind of a lay term. It's not a very scientific term. I'll give you the difference between counseling and psychotherapy is this. Psychotherapy is a two-way street. The client and the therapist are equal, and they work together in finding solutions to the problems. Counseling is more a one-way street where the counselor tells them, do this, do this, do this. That's why we have career counseling, because it's a one-way street. You say, what do you want to do? These are your options. So it's more a dictative kind of a directorial thing where it's not more of a it's less collaborative, and it's more just an individual kind of saying these are the things that will help you. So counseling is probably the thing that you don't really associate much with mental health and all this. It happens at a very basic level. You can give counseling for depression just to tell the person what depression is about, but that's very different from therapy, because the therapy is a two-way street. You need to do as much talking as a therapist, so to figure out how to deal with these kind of problems.
There was one more thing which I wanted to ask you, Vinay, is that I think I was lucky meeting a psychiatrist and I was open and he solved everything for me and it was like a perfect storm. But I know a lot of people who meet psychiatrists, right? Or meet therapists, psychotherapists, but they keep jumping from one to the other and they're unable to find one which actually helps them. And they're desperately searching for this particular help. So why does that happen? And could you throw some light on
It could be because many mental health conditions, by research, they've proven that a combination of medications and psychotherapy yields the best result. So when a person really is reluctant to take medicines and his anxiety or his depression is at a point where therapy is just not enough, they might attribute it to the therapist's inadequacy and keep shifting and moving on, thinking that it's not working. So, sometimes it comes down to the fact that therapy might just not be enough. If you're looking at severe depression or addiction or severe anxiety or bipolar disorder or schizophrenia, you need the help of medications, because therapy is going to augment or enhance the benefits and improvement that you get with medicines, but as a standalone treatment, it's not going to be enough.
that? Wonderful. I think that clarified a lot.
Yeah, but also I think said that if you do look in the field of medicine, like when I have a patient who comes in for surgery and we counsel him that okay, you need to undergo surgery, you find that they will go through one or two surgeons, and if you actually look at it, they're all pretty much on the same level, same profession, experience, etc. But why do they get operated from one and not the other? It just comes down to connect and communication, and sometimes you just communicate better with someone else other than the other, and that's what it is. I feel sometimes you just find that bond and that person speaks your language, and and it's subtle.
No, that's exactly I said. I think I was very lucky to find that comfort factor, and it kind of worked
Correct.
out well for me. But I think Vinay also made some great point where it's just a psychotherapy alone is not enough, but you need a multi-pronged approach.
Ashish, so you probably have seen this a little bit in your field. So, how do you deal with people who don't believe in orthopedicians but believe only in that traditional cast thing that they wear, right? So, they might have severe displaced fractures which are going to cause chronic, non healing, all kinds of problems, but they will still refuse to go to an orthopedician and go and get that traditional cast thing just because they have no belief. So, it's something that you deal with. And how do you deal with that?
Oh, it's very, very difficult, Vinay. Very difficult. And the sad part is what I find that the people who are most affected in that segment are the people who have no voice for themselves and their children. And you can cry out to them, you can urge them, you can tell them everything. Sometimes it's monetary for them, and you can try and guide them still to the government center. But I think there's just only so much you can do. I mean, in my field at least, we can try and counsel them and tell them, but then ultimately, usually by the time I have to, once they deal with the acceptance, they've already burnt their hand, and then they're coming back with full blisters and infection, and usually the child suffers. So yeah, it's very difficult. We really don't have an answer for that. I mean, we can try our level best, but it doesn't work sometimes. So I can imagine how much more difficult it is
Exactly.
for you.
So you multiply that into 100, and that's how much that's that's how hard it is for people to come to psychiatrists and for psychiatrists to convince them that they actually need help.
Touche, 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 buddy.
So this particular belief in a different system, I think even that is a kind of an addiction, if you want to call it. You're addicted to that kind of a treatment, whether it's homeopathy or might be a placebo or might be whatever it might be, right? Would that fall under addiction, or does addiction have a very specific classification?
I don't think that falls under addiction, because addiction is more a behavioral pattern where you get, hooked onto something and it dominates your life. You neglect other things, and just a strong belief system, probably passed on from generations and trusted on, by elders on the younger ones. So that is probably why we are a little backward in this aspect, because the fact that they have strong belief systems is good in many aspects, but in such aspects it can also be a huge barrier.
But funny you mentioned addictions. I mean, like, if I could just segue a little bit
I
into
don't think it was
into
funny.
that.
Not a funny topic,
No,
seriously.
no, I agree. It wasn't. Yeah, but I was just talking about addiction, and you mentioned addiction. And another thing which has been on rise this pandemic has been addictions. Especially alcoholism, which has led to a lot of abuse. Also, do you see a rise in addiction also among your patients?
Huge, huge. I mean, if you're talking about the pandemic, yes, anxiety, depression, these problems have really surfaced. I wouldn't say yes, it's increased, but I would say it's surfaced because they were always there, and this has kind of, brought it forward. Addiction, definitely, yes. And this has been a problem which has been on the rise, especially in low and middle income countries. So, India, if you look at India, the alcohol use rates are going up. All the other substances like cannabis use rates are going up. Now we're dealing with a lot of behavioral addiction, which is gambling addiction, addiction to pornography, addiction to gaming, addiction to internet. So these are all behavioral addictions. So yes, it's rampant, and you take someone's social life out, you take someone's routine out, you give them a gadget, and yeah, at that age they're going to get hooked, and they're clueless about lifestyle balance and work life balance. They just completely get hooked on. So I would say probably more than substance abuse, I would say internet and gaming addiction has probably really shot up since the pandemic.
Yeah, yeah, I must agree with you there, Vinay, because see, we are entering into this generation of getting your dopamine fix so fast that you can just take your TikTok videos and your real videos. There's a reason why they're only 30 seconds and not more than that, is because your attention span is so short, and you need your next fix, and then you're moving on to the next one. So, but having said that, are there certain traits in people that that makes them more prone to addiction?
Yeah, absolutely. So you spoke about dopamine, and that's interesting because actually, more studies are now showing that people getting a high from playing a particular game is not very different from the high a drug user, like a morphine user or a heroin user, gets. So the pathways are fairly similar. So that's why they're kind of trying to reclassify this whole thing into a behavioral addiction. So, the medications for that addiction and this addiction is not very different. Yes, we are going to give something a little extra to deal with the toxicity caused from heroin and cocaine use, but in terms of preventing them from going back to it, it's very similar to the drugs we'll give to a person who's addicted to gaming. So in terms of dope, and dopamine is the main culprit here. And so, I was mentioning about this emotionally unstable personality, and these are the personalities where they're very impulsive. They don't really think. They have a lot of difficulty in regulating emotions. So these personalities are at a very high risk of any kind of substance use. There are other personalities also. So people who have a lot of anxiety, they're very very introverts. People who are the reclusive types. Now they start maybe smoking some weed, taking some alcohol, and they're a completely different person, and they just completely lighten up, and they're everyone likes their company, and they like themselves more in that state. So they start using it more, and weekends become thrice a week, and it becomes kind of a necessity for them. So that's called the self-medication hypothesis, where a person resorts to substances to deal with their kind of problems. There are also a lot of other problems, like you see people with antisocial personalities, people who get into gangs and violence and stealing, and they also resort to alcohol to give them that little extra courage. And so there are a lot of personalities that are more vulnerable towards addiction. This is why it's important that people who have this addiction problem, yeah, they go to a general physician and they get detoxified, so they take care of their health problem. But the next aspect of preventing relapses and talking about it and identifying why they got addicted and not someone else. Why, if 10 people are going to smoke up, why do two people get addicted? Why does the other eight not get addicted?
Correct.
So it's
Correct.
important that that's where we come in. You need someone to professionally analyze them, to talk to them, to figure this out, because right now the way substance abuse is treated in India is so sad, because there's so much stigma, and they don't understand that this is actually a medical problem. Addiction is actually a medical problem, and a person who's addicted is just thrown into a rehab center for 6 months. It's like it's jail. They're beaten up, they're tortured, they're locked up, and they think, okay, that's enough punishment, he's going to stop. That's not how it works.
But the other thing is always the relatives always shouting out that you don't give your child enough attention, and that's why he is going out and doing all this. Is that true?
Again, these are just rationalizations. I mean, they're just trying to rationalize their behaviors and trying to play. It's never one thing, and it's in any psychiatric problem, it's never one thing. That's why we like to call it the biopsychosocial model. So genetically there might be something in him that makes him more vulnerable. Psychologically something might have happened in his childhood. Sociologically some stress might have been there, but all these things have to work together to make someone really go into this. It's never just one thing.
Right. And I think we've been talking a lot about how it's affecting adults and stuff like that. And I think Ashu just brought up, and you just did, about how your childhood is and a lot of factors of it. Now, what about children? What about young adults who probably haven't reached a stage where they can take a decision by themselves, but it's a parent's duty to try and look out for these things and channelize the right help towards them? What would you say from that aspect?
Yeah, when it comes to children with any kind of mental health issues, the grassroots have to be there. We need a lot of school programs, we need a lot of screening programs, we need pediatricians educated on mental health, we need pediatricians educated on ADHD, on learning disabilities, on gaming, on addictions. And so it has to happen at a more primary level because of the stigma at this point. Even if a child is suffering and a teacher or a friend says go meet a psychiatrist, they're like, no, 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 my child's fine, please back off. I'm not doing that. I mean, there's something wrong with you. So parents come only when they are helpless. But if someone else suggests that something might be off or something, the child might need something, they immediately get defensive.
But sometimes I remember back in school, we used to have the counselors, and for me it was a bloody joke. It was like they used to always want to know what is bothering you, and nothing really bothered me. I just wanted to play the guitar more than I wanted to study. But if I just gave them that answer, they never ever accepted it, and then I'll have to tell them, yeah, nobody ever listens to me, and then they're so happy, and then they're like, yes, you know what. So I think sometimes, in school it's a complete joke.
Ashish, what you said was funny, but actually it brings in a really important point. And you were really lucky that you had a counselor, because your problem was just liking the guitar more than studying, and not really something that you're not going to really panic, or you're not going to go through any major depression because of it. But the fact that you were directed to a counselor, now in your position, if it was a girl who was being sexually abused, she would be so glad that that counselor was there, because she would have no outlet otherwise. The parents are not going to listen to her. She would have no one to go to. So having that counselor, gives people the opportunity to deal with these kind of problems. And it's not for you, but for someone who's being abused or someone who's being really bullied, now they have at least some door which they can open so that they can start getting help.
Absolutely, absolutely.
Another thing which absolutely fascinates me, and yes, I know a lot of people struggle with it, is multiple personality disorder.
I'll tell you this: multiple personality disorders, you can only watch them in movies, because a psychiatrist would be lucky to see maybe one in his lifetime.
Oh, wow.
It's so fantastic, and people love to take movies about it, but it is one of the rarest things that we see. It's just not common. It's more like there's so much of fantasy and all kinds of things that you can add, that it's one of the best disorders that you could take movies for, but it's we just don't see that in real life.
Sorry to let you down, Sidhu.
By the way,
I'm
it's a
not let down, dude. I'm just wondering, one of our listeners who has multiple personality disorder, like, shit, dude.
I'm a superhero. This world has got me wrong. Yeah.
just by the way, I hope you don't mean movies like Beautiful Mind, because that's not multiple personality disorder, that's schizophrenia.
No, 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 no.
It is a joke, actually. Like, psychiatrists joke about multiple personality disorder because no one sees it.
It's an urban myth.
Well, but that is us normal people. But I hear that the hardest people to treat are doctors. And do psychiatrists go a little cuckoo after a while after seeing so many cases? Just an honest question.
All psychiatrists and all neurologists, by the end of it, they all have ticks. I'm waiting to see your tick.
Neurologists, no. Why? Because I don't know. I think psychiatrists and dentists have the highest suicide rate. Yes, so it does take a huge burden. We need to have a very balanced lifestyle, because the amount of I'm not saying we take everything to heart, because at some point we also have to be a little, I wouldn't say mathematical, but I would say we would have to be rational and think about treatment steps and decision making and all that, so we don't necessarily get emotionally involved in whatever the patient's talking about. Though when it comes to therapy, we need to be open to it. But yeah, I think this really brings in the question of work life balance, and especially for in this case psychiatrists or anyone who's dealing with a lot of stress, it's important that they have an outlet. And this is something that a lot of people are ignoring these days, is this fast paced life and work sleep. You need to spend 30% of the day doing something you really enjoy and you love, because that's the only time you can switch off. And this could be me time, it could be time with your kids if that's what you enjoy, it could be playing a sport. But if you don't give that time for yourself, you're going to burn out. And I've got golf, so that's what's keeping me going.
No, I think what you said, Vinay, is absolutely true. I mean, and makes us laymen who are seeking help from professionals like you and as well as Dr. Ashish over here, that even you guys find it tough, and you guys are also susceptible to all these things. And it's important for us to take care of ourselves, keep an eye out for it. seek help when it's necessary, seek professional help. Do not hesitate to go to a doctor, to a psychiatrist. I mean, we don't hesitate to go see a doctor when we have a common cold or a fever. So why are you guys hesitating to go see a doctor when your own mental health is getting completely off the track? So sincerely urge you, I'm telling you purely from experience, that I've had the most positive experience from going to a psychiatrist, and I've come out absolutely scotch free. No electrical shock therapy or thing. I can tell you that some of the meds were really nice, but they are not addictive. But it really, really does help you. Yes, as Dr. Vinay said, you need to spend about 30% of your life to de-stress and do things that you really, really enjoy, probably like listening to the Odd Couple podcast. So tune in every fortnight to the Odd Couple podcast, where we bring to you really interesting stuff. And thank you so much, Dr. Vinay, for sharing your experience with us and patiently answering a lot of sometimes stupid questions.
And most importantly, coming in as that expert quotient among the two lame guys over here, and sorting out all our issues also. Thank you, Dr. Vinay. I think it was much overdue, your visit, and we're really looking forward for some good medical sound advice for the both of us somewhere down the line, to shut the crackpots up.
Thanks, guys. It was first nice to catch up with you guys, and this really was. It was good because I've spoken on other mediums, but to in this kind of a setting where it's informal but still very relevant to today's problems. So it really was nice to talk about this.
Absolutely. And to our viewers, please sometimes don't take yourself too serious. Life is good. Get help. It's not so difficult. And like what Sid said, you don't always have to have medication. Sometimes just talking to the right person is the best medication.
Absolutely. So thank you once again, Dr. Vinay. Thank you, Ashish. And thank you everyone for tuning to the Odd Couple podcast. See you in a couple of weeks. Bye-bye.
Bye bye.
Bye bye.